No pain, no gain. Well, Dr. Nicholas Mercer with uImproved PT. So you hear this all the time. It's become a mantra in people who are trying to train and make themselves stronger, better, faster, and some other adjectives. No pain, no gain. That's a really difficult question to answer because there's a lot of specifics that we need to figure out. So, should you train through that pain? Long story short, it depends. It depends on what type of pain you're having and when you're having that pain. So, normally when we hear the mantra, no pain, no gain, we like to think of that as, oh, the muscular burn that you feel when you do very intense exercise. The soreness that you get the next day. Those two types of pain are kind of what that saying is referring to. And yes, it is very hard to get stronger, have more endurance, become more flexible, and improve kind of these physical attributes of your body without going through some type of pain and discomfort. I worry that a lot of people take that too far. So what type of pain do we not want to train through? Joint pain, any sharp pain, anything that gives your brain a signal that says, ouch, this is not okay. How do you recognize that? The main thing you need to do is remain mindful of your body, right? So you need to start to be able to distinguish, are my muscles burning? Are they working? Or is this something that I need to be worried about and I need to stop or it will get worse? So one way to recognize this pain is is it in a joint, right? So your joints should not be painful. Normal joints are not painful during exercise. If you are having pain in your joints during exercise, there's something going on there that you may need to get checked out before it gets worse. Another type of pain that you want to make sure you don't push through is muscular pain, or really any pain that is sharp in nature. You could take your finger, you could put your finger right on where that pain is, and it makes you do this. That is pain that we do not want to train through. Furthermore, we also want to make sure that if we are feeling soreness, we're not confusing that with a problem in the muscles. So a lot of times when we have DOMS, which is delayed onset muscle soreness, the day after, even 2 days after performing an activity that's pretty intense, especially one that is not one that we do very often, you're going to get sore. Most of the time, once you start moving, once you get the blood flow back and those muscles get heated up, the soreness will decrease some. Now, being able to differentiate that soreness from an injured muscle is going to be very important. Again, if you're having a sharp pain, any swelling in the joints or muscles, it's very likely that there's an injury going on. That is pain that you should not push through. Any joint pain that you're having, whether it be in your shoulder, your knees, your hips, your back, any joint pain that does not seem muscular in nature is definitely something we do not want to train through. So you've identified now, we know what burning feels like, we know what soreness feels like, and we know more or less what an injury feels like. We need to differentiate those first, and if we decide that this is an injury type of pain, what do we do? You obviously don't want to stop training because you're training for a reason. You want to improve some part of your physical body. Now, I hate telling my patients to stop training. Pretty much every single person can train something in their body that will help reach their goals without increasing the pain in a joint, in an injury, right? You can do exercises, you can do activities that will still help you reach that goal without irritating the joint pain, the injury pain. Now, it's going to be different for everyone. It's going to be different depending on your injury, but most of the time there are ways to work around it. However, that doesn't necessarily mean if we just let that rest, it's going to get better, especially without proper intervention from either a physician a doctor of physical therapy or some other healthcare practitioner who's qualified to improve those injuries, to get those injuries better, to get that bad pain, that injury pain or joint pain to go away. But this is a way that you can continue to strive towards your goals while you are getting the right treatment to eventually get that pain better and get back into training everything so that you only get the burning pain and the soreness, that good type of pain that we are referencing in that no pain, no gain statement, right? So just to wrap up, a few things we want to remember. No pain, no gain. Do not take that too strictly. That pain is just for the burning and the soreness in the muscles. If you're getting any symptoms, any pain in the joints, if you're getting any sharp pain or swelling in any tissue that you have, we want to stop. We want to get that checked out. But that doesn't mean that we need to stop training towards our goals. There's always something you can do to push you towards your goals without irritating that joint pain, unless, of course, your doctor or other healthcare practitioner tells you specifically not to do those things. So always listen to those people that are there to help you, but also realize that if you are having that bad type of pain, the injury type of pain, again, like I've been saying, hold off, find a way to work around it, and get that good burning soreness type of pain. So if you have any questions, leave them in the comments. Feel free to visit uImproved.com. There we have a lot of free information and strategies on helping get rid of that bad pain wherever it may be in your body. And again, let us know if you have any questions. Subscribe to our blog, subscribe to our channel on YouTube for more videos like this. And we are looking forward to helping you improve your movement and improve your life.